to introduce Shireen. Shireen is a haematologist and the founder of Plant-Based Health Professionals UK, and has been working really hard on advocacy to bring plant-based nutrition and lifestyle medicine into mainstream healthcare. And Shireen, do you want to get started? And we'll look forward to hearing from you. And then
Great. So hopefully you're seeing my slides and can all hear me okay. It's just in full view now. Is that view okay? Because I seem to have it in speakers set it. Brilliant. Yeah. So thanks ever so much for the opportunity. Feeling a little out of place in a renal setting, but hopefully I can share something that may be of interest, and of course recognise some of you in the audience already. And so really this perspective I'm coming from is the fact that alongside my haematology, I'm very passionate about preventative healthcare. I see comorbidities and chronic conditions in all my patients with haematological cancers. And for that reason, I certified in lifestyle medicine. And so I spend a lot of my time spreading the message about lifestyle medicine. And I work together with Giovanna in my non-profit called Plant-Based Health Professionals UK. We provide education advocacy initiatives around plant-based eating and lifestyle medicine to improve our health and, of course, support better planetary health. And I'm the sustainability lead for pathology practice. So if you have an interest in pathology stuff, then you can invite me to talk more about pathology sustainability in the future. And much of what I'm talking about, I work for the University of Winchester, where I provide formal online courses actually there. So what I hope to cover, and it'll be about 20 minutes, and then it'll be followed by Giovanna for 20 minutes, and then we'll open up to questions hopefully. Like, what is lifestyle medicine? And why is it important? And I expect many of you know about the principles, but I'm going to bring it into focus around the benefits of lifestyle medicine for people with kidney disease, and then open up a conversation about how we might bring this into the workplace. I mean, I've been trying very hard, and I certainly haven't got all the answers, but we've got some nice good practice examples to share with you. And again, this will be very familiar to you, but I mean, I think the goal 3, ensure healthy lives and promote well-being at all stages and ages, is where I'm placing this talk. And for me, the most sustainable healthcare is the healthcare we do not need. So really focusing upstream on prevention, which unfortunately we're not so good about doing in the NHS. And the result of not focusing in on public health and prevention, which, you know, we only spend 5% of the NHS budget on, is the fact that much of what we're seeing in the NHS is potentially preventable, if not significantly delayed onset, you know, such that we could be living longer, healthier lives. And of course, you know, life expectancy has gone up, but unfortunately what is happening now is that the years spent in ill health are increasing, and I'll come back to some stats around there. But you know, if we survey the extent of literature out there on prevention, if we were to address lifestyle and socioeconomic factors, much of the common chronic conditions could be, you know, wiped out. So, you know, heart disease, 90% preventable. Similarly with stroke. For my specialty of cancer, you know, 40% are preventable if we paid attention to lifestyle behaviours. And for type 2 diabetes, 70% is related to dietary risk factors, and the rest to other lifestyle and socioeconomic determinants. And we're realising also that the same risk factors that lead to heart disease and type 2 diabetes are increasing the prevalence and incidence of dementia, for example, as well. And then, as I mentioned, the result of this is that we are spending increasingly the last decade, if not the last 2 decades of our lives in ill health. And it's worth mentioning that obviously ill health and lifestyle and socioeconomic factors are not equally distributed. So those most vulnerable in the lowest socioeconomic groups in society are those who are spending up to 20 years in ill health because they have higher rates of exposure to unhealthy habits and higher prevalence of chronic conditions. And of course, this isn't about personal choice, it's about the environment we're living in and the choices that people are able to to make based on income and other factors. So in my view, and shared by many in here, I'm sure, is the fact that we really need to address lifestyle factors. And lifestyle medicine is the most rapidly growing specialty globally. It started off in 2004 by the American College of Lifestyle Medicine, that's gone from strength to strength, and now it's a global movement. And there's a lot of work going on in the UK around this. And my organisation, along with others, are offering accreditation in the field of lifestyle medicine. And it pays attention to 6 pillars of lifestyle medicine: healthy eating centered around a whole food plant-based diet, increased physical activity, managing stress, forming and maintaining healthy relationships, improving sleep, and avoiding toxic substances, predominantly alcohol and tobacco. And the reason why lifestyle medicine is so successful when it's implemented in prevention or even management and treatment of chronic conditions is because it really addresses the root cause of many of our chronic conditions. And you can see the mechanisms that are at play in yellow on this diagram that are leading to so many of our chronic conditions. So microbiome alterations, epigenetic changes, and cellular stress, which ultimately lead to inflammation, this chronic inflammation that drives many of our cardiometabolic conditions, cancer, and you know, for you guys, increases the risk factors for developing chronic kidney disease. And the good news is that you can really intervene at any stage to improve this trajectory, to reverse this inflammatory condition and go back to a state of health, because we've got a lot of evidence that not only are lifestyle interventions useful for prevention, but even in established disease, we can make a real difference to people's disease trajectory and quality of life. And for me, it really aligns with the NHS priorities, and especially the latest publication, the 10-year health plan, because it really wants to bring prevention into the forefront, but it doesn't really pay attention, or it's not clear to me how we're going to implement that. But the NHS priority has to be health promotion. We know it's committed to net zero, so reducing reliance on healthcare is key. Lifestyle medicine really considers our own health, the planet, and of course the animals we share this planet with. Financial aspects, you know, for every £1 spent on prevention, you can save 3 times as much, so £3 saving in the future for diseases that were prevented, and of course this would be more inclusive and address DEI issues and make the playing field more level when it comes to addressing health inequalities. So just going to highlight some of the key information that's out there just to give you a flavour. I'm going to share the PDF version of my slides, so don't worry about writing all of this down. But you know, back in 2009, this paper is a cohort from Germany showing that, you know, in 25,000 German participants followed for about 8 years, those adhering to these healthy habits shown in green had a 78% lower risk of developing chronic diseases, and they look specifically at heart disease, stroke, type 2 diabetes, and cancer. So this comes back to that stat that I gave you at the start, you know, that 80% of our chronic conditions could be prevented or at least significantly delayed. So what data do we have for people with kidney disease or risk factors for kidney disease? Well, you can see that this study that analysed healthy habits or lifestyle habits in participants in the UK Biobank, and those habits are shown in the left hand side. There were 8 factors, which are also the same factors that are used to address sort of cardiovascular risk, and you can see that on the right hand side it shows the population attributable risk attributable to these risk factors. And overall, just to make it easier to explain, these health-related factors were responsible for 70% of the risk of developing CKD over 10 years. So that means if we address these 8 lifestyle habits, we could prevent 70% of the chronic kidney disease that we can see. And then more robust data in the setting of primary prevention of CKD. We've got the systematic review and meta-analysis looking at different lifestyle factors and dietary habits, and show how much you can reduce your risk of chronic kidney disease if you increase your intake of vegetables, increase dietary potassium, which we know is high in healthy plant foods, increase physical activity, reduce, I would say avoid, alcohol, lower sodium, and stop smoking. So really significant difference we can do upstream mainstream. And then we know that we can benefit people who've already got established chronic kidney disease by addressing these same risk factors, because we can then address issues such as overweight and obesity, dyslipidemia, hypertension, high levels of urate, cardiovascular diseases, type 2 diabetes, cancer, and this all then leads to slowing progression. And I think you'll probably recognise in your patients that they have all of these conditions, or at least a combination of a few. And I think the difference between implementing lifestyle medicine opposed to what we use in the kind of medicalized model of healthcare and patient interactions is that this really does require a different way of interacting with our patients. You know, it's moving away from us being the expert to us being a collaborator in their journey to improve health. So we need to sort of adopt what's known as a coach approach, and it's around, you know, being empathetic, aligning our motivations, building their confidence, setting smart goals, and being accountable. And there's a really nice reference that I've given there if you're interested. And so health coaching really comes into this, and we need to also be credible and trustworthy in this space when we're giving advice, by also role modeling this in our own lives as much as possible. Now, as Frances mentioned, my pet project, or my pet interest, is around healthy diets. And so if we zoom in on diet and chronic disease and chronic kidney disease, we're in a really bad state in the UK. You know, 1 in 4 deaths in the UK are related to dietary risk factors. Dietary quality is reducing and deteriorating, as evidenced by the most recent National Diet and Nutrition Survey. And the Food, Farming and Countryside Commission at the end of last year modelled or calculated the cost of unhealthy diets to the UK economy, and it amounted to £268 billion a year, a figure that you'll recognise as more than the budget of the NHS. And these were both direct and indirect costs to health, you know, to the NHS, to social and welfare costs, and loss of productivity. So it's astronomical, and so we cannot carry on like this. So in the field of lifestyle medicine, a healthy diet is one that is centred around a healthy plant-based food, so fruits, vegetables, whole grains, beans, nuts and seeds, mainly water for thirst, and lots of herbs and spices, because not only is it delicious, but they provide antioxidant and anti-inflammatory properties. And the beauty of this way of eating is that it's adaptable to all cultural and traditional diet patterns. And it doesn't have to be all or nothing, but the predominance of your diet, whatever you call it, you know, Asian, African, veggie, Mediterranean, the centerpiece, the healthy foods that have to be emphasized are shown here. Half the plate fruits and vegetables, a quarter whole grains, meaning not the refined grains we're so used to eating, and healthy plant sources of protein. And it has numerous benefits. This plant-predominant, plant-rich, plant-forward way of eating, whatever you want to call it, is associated with a healthier body weight, better blood lipids. It's high in fibre, so helps with satiety, with gut health, insulin sensitivity, lowers inflammation, is naturally low in free sugars, and is healthy across all stages and ages of life. And I've just summarised here just a handful of the enormous amount of evidence there is that supports this way of eating for preventing chronic disease. And there are papers, more than just this one that I've cited, demonstrating that plant-based diets reduce the risk of kidney disease for reasons related to reducing risk factors. And the protein, the plant protein is specifically, good for you. Swapping out animal source foods for foods that are rich in plant protein, such as legumes and soya and beans and seitan and things, is really beneficial for kidney health. So again, these are data from the UK Biobank, and they showed that people who were consuming more plant sources of protein had a lower risk of developing chronic kidney disease over a 10-year period. So really, healthy sources of protein are from plant foods. And the benefits of this way of eating are enormous, even for people with chronic kidney disease. And I see Angeline in the audience, and we have created, or the BDA kidney group has created, in collaboration with my group, some fact sheets for people with chronic kidney disease as well around plant-based eating, because there's so many benefits to increasing fibre, reducing animal source protein. It addresses acidosis, improves creatinine and reduces glomerular, glomerular hyperfiltration, and then has positive downstream impacts. And people are now talking about in your profession, that a plant-dominant, low-protein way of eating for people with chronic kidney disease. And so there's quite a literature out there on this now. And one really key benefit of plant-based eating for people with kidney disease is the fact that the fruits and vegetables can address metabolic acidosis. So we've had quite a long follow-up of one study that randomized people with metabolic acidosis to either oral bicarb or eating more fruits and vegetables, and actually there were much greater benefits for the people eating the fruits and vegetables, because there was also benefits for reducing blood pressure as well, and they provided fruit and veg for household members as well, so everybody could benefit from increasing consumption of fruits and vegetables. And some people actually delayed getting to dialysis by consuming more fruits and vegetables. And this is just an infographic that goes through why fruits and vegetables are so useful in modifying metabolic acidosis. And I love the infographics that the National Kidney Foundation in the US have got, but I've just put one up on the left there. But there's really emerging benefits for people on dialysis for eating a plant-based diet as well, although I appreciate it does need careful dietetic support, and I wouldn't suggest anyone on dialysis just goes ahead and does it without specialist input. So in the last few minutes, I just wanted to highlight some key pioneers of lifestyle medicine. Dr. Dean Ornish is the founding father of the lifestyle medicine movement, and he's conducted a number of studies with his lifestyle program that involves a plant-based diet, managing stress, stopping smoking, group support and physical activity. And it was back in the 90s that he published his paper in the Lancet demonstrating that people adopting a healthy plant-based diet and lifestyle habits could arrest, if not reverse, chronic artery disease, and these were end-stage patients. It's now commonplace to talk about remission of type 2 diabetes, and the American College of Lifestyle Medicine have a position statement about the use of lifestyle medicine to induce remission of type 2 diabetes, putting into practice everything that I've talked about with the 6 pillars. And it of course comes down to weight loss, but you can achieve weight loss in a healthier fashion if you adopt a plant predominant diet and address other lifestyle factors as well. And then we've got a meta-analysis in people with kidney disease around lifestyle interventions, and this included 68 studies looking at different aspects of lifestyle, and basically was able to demonstrate numerous benefits to kidney function, protein loss, blood pressure and body weight. And I think it was Angeline that pointed out this seminar in the Lancet on chronic kidney disease and strategies for management, and it really emphasizes the benefits of lifestyle interventions. So for me, and I hopefully more so for you as well, we're moving to a different way of treating chronic conditions, because lifestyle approaches can be adopted in any specialty, and I try and incorporate it into my haematological practice as well, because it's really about connecting physical, mental and spiritual health together. And this a review article that I've cited is called From Chronic Disease to Chronic Health, the Evolving Role of Doctors in the 21st Century. And it really talks about how our health and the planet health is interlinked, but also thinking about mind-body physical interaction. And there's really great examples from New York City where there's been a massive expansion of lifestyle medicine programs throughout the city, and demonstrating that it can improve quality of life, health metrics, and food security, because healthy fruit and veg boxes are distributed to participants in the programme. We've got some good practice examples from here in the UK, and if you haven't heard about this, Oxford University over the last 10 years have got this programme called Here for Health. So do have a look at their website. Patients and staff can be referred to their lifestyle medicine programme that's housed at Oxford Hospital. For me at King's College Hospital, things that we've tried, we have a walk with a doc group. So we have a monthly walking group that is used as a vehicle for imparting lifestyle medicine counselling to staff and patients every year, twice a year in January and May, we encourage staff to adopt a plant-based diet and support them to do that through various sort of support mechanisms, WhatsApp group and recipes and things. We've got a really active liver support group. It's called Live Fit. So if you have any patients with fatty liver or liver conditions, it's a very active group that's now sort of got global recognition. And on site, we have some social prescribing initiatives around growing fruits and vegetables. And Francis perhaps mentioned around our initiative, which is a collaboration across third sector and supported by the Centre for Sustainable Healthcare and 24 other groups around shifting meals within healthcare settings to plant-based meals as the default. And we've also worked with the UK Health Alliance on climate change and produced this how-to guide for catering at events and conferences in the healthcare setting around prioritising plant-based meals. So I hope in this short time I've demonstrated that lifestyle interventions are first and foremost in disease prevention and treatment guidelines. The challenge comes with supporting people to make sustainable changes. We need to raise public awareness and educate our own peer group. We also need to address all social, economic and cultural factors, but also to advocate for policy change so this is part of healthcare and healthy behaviours are accessible and affordable to everybody. And so my organisation offers the International Certification in Lifestyle Medicine. If I've inspired you to learn more, please do reach out to us. Giovanna did the certification last year, so I'm sure she'll be happy to speak to you if anyone's thinking about qualifying in this specialty. So thank you for listening, and I will hand over to Giovanna.
Lovely, thank you. Just gonna try to share my screen. Can you all see my screen?
Yes, that's great, Giovanna. Thank you.
Yeah, and can you hear me well?
Yeah, very well.
Yeah, lovely. Thank you. So good afternoon, everyone. It's really a pleasure to be here with you today. So thank you so much for having me. And my name is Giovanna Dicandia. I'm a registered nurse. And today I will try to share what nurses can do, and especially in kidney care, to play a role in using more plant-based nutrition and lifestyle medicine as a tool for prevention and for sustainability. Before we start, just a little bit about me. I've been a nurse for 15 years now. I'm currently working as a heart failure nurse practitioner, and majority of my patients sadly have some sort of stage of renal disease. And I have a passion for sustainability. The last bottom picture is me promoting education for staff and for patients around the importance of plant-based diet in my workplace. And as Shireen mentioned, a nurse lead at Plant-Based Health Professional UK in the last year. And the first picture is one of the events organized by Dr. Kassam organization. And I was with other inspirational nurses, and is the Nutrition and Lifestyle Medicine Conference, which is going to happen again in the next 2 weeks. So you're very welcome to join, and we'll be hopefully seeing more nurses this year. And thanks also to Plant-Based Health Professional. Last year I qualified as lifestyle medicine professional, and I wanted to put this picture of me on my bike because I wanted to just to share that I've been cycling to and from work for the past 10 years, and I finally managed to put in practice what I've enjoyed all this time. So I've been able to help shaping a new initiative within our cardiac rehabilitation clinic. So we now we are able to signpost patients who have had heart surgery or live with a cardiac condition to join a group cycling session. So we are promoting physical activity, social connection as part of one of the pillars of lifestyle medicine, and also making sure they possibly can build a habit to use a more sustainable method of transportation. And all this started when I became vegan in 2020, first because I came to know what what happens behind closed doors in meat and dairy industry. And then I've learned from evidence-based data that meat is a carcinogenic and contributes to as a direct cause of cancer, specifically processed meat like ham or bacon. And so I was first moved by compassion, but then also by science and evidence-based, which we use every day. And these are also factors that are like a common denominator in nursing. So it felt natural to me to adopt this lifestyle. And so I try since then to apply what I was learning. And I have joined the Florence Nightingale Foundation and applied for the Green Leadership Program in 2023. And that you can see me on top in the white dress at the ceremony award. And my work with them was to gather data around how we can promote plant-based food in healthcare settings. And I'm also a member of the NHS England Nurses and Midwives National Sustainability Network, which is good. And so now we all know the World Health Organization has called the climate change the single biggest health threat facing humanity. We have rising temperature that will directly and indirectly affect kidney health from heat stress, dehydration, food insecurity, and pollution. And from last week, I came across this letter from the Climate Change Committee warning the UK government to prepare for 2 degrees of warming by 2050. And at the moment, we are seeing a lot of extreme events in the UK, such as like heat waves, wildfire, flooding, droughts, and that is at the current level of 1.4 degrees Celsius of warming. So as you can see in the graphic here from that report, we are aiming, projecting to have 4 degrees Celsius by 2100. So within this century, we might have an inhabitable planet, basically. And so why there is an importance also on kidney health. Chronic kidney disease affects about 10% of the global population and is rapidly rising. So this is projected to become the 5th leading cause of premature death by 2040. Only in UK alone, there are 7 million people living with some sort of kidney disease from different stage, mainly from 3 to 5. And 70,000 people receive dialysis, which has a huge carbon footprint, around 3.8 tons of CO2 per patient per year. And obviously, as well, heavy economic burden. So the prevalence of kidney care is not just about dialysis, also the impact on the environment that comes from medical treatment, transportation, hospital admission, renal transplant. But the good news is that diet and lifestyles are modifiable factors. And as nurses, we are ideally placed to support patients in making changes towards a more sustainable diet, and that can help the health and the planet. And this is important because as we know, the NHS has recognized the climate emergency since 2020, and we know how we are interconnected with the climate and how our health depend on it. And we can see, for example, in this image that at the bottom we have all the environmental changes happening now, and all the resources, like for example water, that are going short, and all this will put a pressure on and have consequences on the society, and will have, as Shireen mentioned, for example, inequalities coming through, because communities that are weak will become even more weaker, and this will amplify the health risk for those living in minority and weaker communities. And so we can see, for example, as those will be having an impact on the healthcare system, because we're going to try to cope with all this pressure that are coming from the climate change. And eventually on the top layer we'll have the adverse outcome experienced directly by individuals. So we can have like heat-related illness, evacuation trauma, but also chronic obstructive pulmonary disease, asthma because of air pollution, infection with the risk of pandemic, as we've seen already. And malnutrition, and also, for example, migration and conflict, given the lack of resources and scarcity and instability we're going to face. And so the NHS, as I'm sure you've seen this already, so I won't spend lots of time, but just to show that the NHS has a majority of the direct and indirect emission. So the direct one are in the green arrow. The indirect emission from scope 3 are the largest NHS emission, and food comes into that. Although you might see on the next diagram that food emission totals the 3% from the NHS, and this is from the latest report in April 2025. The previous report in 2022 had a 5-6%, and I'm not entirely sure, to be honest, how this has. I haven't looked at the data how this has. It will be interesting to know how this percentage has reduced. But first of all, the NHS is a large institution, so that number is still significant. And moreover, obviously food is not just a product of the NHS, so it's not like an emission. The emission we calculate is not just produced by the NHS operation. Food is something that we use every day in our life, at hopefully a minimum of 3 times a day: breakfast, lunch, and dinner. So in reality, globally, the food production is, as we are at the moment, is the largest driver of climate change. And globally, food production is responsible for 1/3 of all greenhouse gas emission, and 2/3 come from animal-based food. And as we are at the moment, there are huge evidence that the animal agriculture are causing deforestation, biodiversity loss, and is cause for emission of carbon. Yes, we talk a lot about carbon, but we also have methane and nitrous oxide that are polluting the environment, soil, water degradation, and also the ocean are polluting. And this is all linked to intensive, especially intensive animal agriculture. So by transitioning to a plant-based diet, we can cut emission, protect ecosystem, and improve public health at the same time. Also, because we have to look at what are the impact of unhealthy diet on people's health, and unhealthy diets are responsible for 26% of deaths globally, and that's more than tobacco. And so, especially, I mean, we heard a lot from Shireen's presentation, like the evidence is there, and we know plant-based can reduce hypertension, insulin resistance, inflammation, which is at the base of most cardiometabolic disease, and also can lower, specifically to renal care, can lower acid and phosphorus loads, which is a key factor in chronic kidney disease. And it can also support, plant-based diet can also support a healthier gut microbiome and delay chronic kidney disease progression. So I think since 2024, the plant-based diet is part of the guidelines nationally and internationally. So if you, for example, if you look at the BDA guidance, there is a mention about how plant-based diets are beneficial for people that have chronic kidney disease or a stage of kidney impairment. And just to mention, like, also why plant-based nutrition are better. We talk about cutting less emission and cutting emission having less impact on the environment. And so, for example, here there is a comparison between a plant-based lasagna and chili compared to a beef lasagna and chili. And this study shows how these not also have a better impact on the environment, but also have a better micronutrient score, and they are also significantly cheaper. And have there are more, other examples, like with other meals. And this is, again, I wanted to show you this to add to the growing literature that show that plant-based whole food can be the cornerstone of healthy and sustainable diet. And I wanted to highlight the whole plant-based food, because nowadays we have lots of processed food that is also labeled as plant-based, but is not necessarily healthy. Everything you can see on the right here today can be like donuts or hamburger. We can have like the plant-based version of them, but it doesn't mean they're necessarily healthy. And so there was this study that has showed how there was up to 26% lower mortality when participants had a high adherence to healthy plant-based diet, but then obviously the risk increased when they were having still plant-based food, but that was processed, highly processed. And just to recall the importance of lifestyle medicine is not just about nutrition. So obviously nutrition is the first pillar and one of the most important, but lifestyle medicine includes, as Shireen said, physical activity, restorative sleep, stress management, and avoiding risk substances like alcohol and tobacco, and promoting social connection. And all this, as you've seen, help to slow chronic kidney disease progression and improved quality of life. So I have tried in the last year to embed this information in my routine clinic in practice when I see patients, and try, as Shireen was saying, using like a coach approach to, I will talk about this later as well, how to help patient understanding what is important for that and how they can make little changes, but important. And so now I wanted to focus a little bit on why it's important that as nurses we use our education in plant-based nutrition and lifestyle to advocate for better health for patients and the planet. I think we live in a different era now. We are in a modern era of nursing, and the last, our previous chief nursing officers had written like a 7-point action plan to remember us that nursing must also lead in sustainability and advocacy. And in fact, the first point was about protecting our planet, putting the emphasis on sustainability, decarbonizing our care, and to be advocating for, as we talk about, that communities that are more at risk from climate change. And at the end of the day, yes, this is all like modern kind of realization, but we already know, if you are a nurse, you surely know Florence Nightingale understood very well the importance of looking after the environment when looking after people that were sick. And so we have taken this from the Florence Nightingale era to today, where we are, as nurses, we sit at a table and we can help changing policies and demonstrating that the focus on climate and nutrition, it's been always at the center of our discussion. And another reason why nurses are important in this role is because, well, we are the largest workforce in the country, but we are also the most trusted. We have scored high for 9 consecutive years now, and in America for 19 consecutive years are the most trusted profession, which brings us in a very privileged position, and of course gives us a lot of responsibilities. So we have to make sure we help people to have power to make change, behavior change, because I feel like when we talk as nurses, people listen, and so we must use our voice to help guide the population towards what the evidence says. And now, so how can nurses help incorporating a plant-based diet in patients' education, in clinic? So first of all, try to get educate yourself. As I mentioned, there are guidelines, and Dr. Shireen Kassam has also showed some resources. And we can also use motivational interviewing, like I was saying before, and trying to find out what is very important for the patient, and try to not kind of dictate what patients should do, but to guide with empathy and try to find out what is more important for them and how that links with their health goals. It could be family, could be environment, it could be success in their work. And even partial shift towards plant-based eating is still measurable and meaningful, even in kidney care. And so, for example, some very simple advice that we can give in our short consultation time is to ask patients to have more whole grains, legumes, fruit and vegetables, and limit processed meat and excess salt, and reinforce simple but like important messages like that, for example, having an extra serving of beans or veg can help the kidneys and make the kidney work better, have less strain, and that by helping our health and helping our kidneys, we also help the planet, because these are friendly food that are friendly with the planet. So it's very important that we use like a language that is positive, and we also we should also address misconception and making sure that plant-based diet are perceived are not expensive, because they will become expensive if we try to buy more and more plant-based processed food. But if we look at whole plant-based food, this is not as expensive. It's actually less, it's more like budget friendly. And of course, the key is not just about us in clinic as nurses. We do have to collaborate with other members of the team, especially in this case, nephrologists, dietitian, and pharmacists. And we also should, this is what I've been trying to do, and we'll talk about this in a minute, to advocate for plant-based option in hospital catering and trying to integrate sustainability into renal clinics. Try to lead on a sustainability quality improvement project, and reducing also food waste is very important, and improving the menu choices in hospital. And finally, be a role model. So, because I think when we make conscious decision about food and we speak out for the planet, patient notice, and also colleagues notice. And this is what I've been up to for the last couple of years. So I have in 2023 started with the Florence Nightingale Foundation Green Leadership course. I have worked on this sustainability quality improvement project, and I have asked the patients and the relatives and the other member of staff, what do they think if we use more plant-based meals in our hospital based on concern on health and planetary health. And the response was that I've distributed 120 questionnaires in a week, and I had 65% of people that were in favor of transitioning to more plant-based food in hospital setting. And so that gave me kind of hope and strength to continue with my quality improvement project. And so I am very happy to say that hopefully, all being well now, next week we will be launching in my workplace a new menu in the staff restaurant, and that is to make sure we promote more plant-based diet, and will be adopted as the default option as we go along in the pilot and for hopefully more years to come. Of course, there are always barriers, and I can talk a lot about barriers, but I've learned that I've tried to use these barriers as opportunities. And so, for example, we know about the barriers. We know we don't have like a lot of training. I find out about training through the Plant-Based Health Professional UK organization, and I have educated myself, but that was in my own time. We don't have curriculum. In our curriculum, we don't have nutrition. It's not taught at our university, and this is the same for doctors. So education is first, and that is lacking. And then we also have to change culture and practical, the practical challenges that are there, because when we talk about food, we talk about culture, we talk about behavior. So changing that it's not easy. And then of course time. I've not had personally dedicated time for this project. am a full-time heart failure nurse in the NHS, but I feel like this is a very important topic, and it does go very well with the values of the nursing profession. So it would be nice if we could have some more support in the NHS, especially not just nurses, but everyone, all the clinicians that are passionate about sustainability. If we could get this even forward even quicker, considering we're talking about a climate crisis, a climate emergency. And so I look at, for example, LED Nurse Initiative that highlighted the benefit on plant-based diet in renal care. I have found many. I found lots of projects about how to reduce, for example, waste, or making sure we reduce cost from procurements and things like that, which is absolutely fine, and we do need that desperately. But we also do need more research, nursing-led research in plant-based nutrition and health. And so you can find, for example, if you want to get up to date, Shireen has talked about the university course at the Winchester University and about plant-based food, but also we have up-to-date training about plant-based nutrition, especially in chronic kidney disease with the UK Kidney Association, the British Dietetic Association, and all this will be helpful to use in our clinic. And ideally, the future should also include nurse-led lifestyle clinics. And it will be important to share successful stories. And so just to conclude, kidney disease is deeply affecting people's lives and the planet. The main causes, as we know, hypertension and diabetes, as well as high weight, are largely preventable, and plant-based diets and lifestyle medicine often offer powerful practical solutions. And we nurses are vital advocates in transformation and guiding patients towards small but realistic changes that can save life and reduce emission. And if you want to read more about like in depth about what plant-based diet how can plant-based diet help the kidneys, we have fact sheets. These are resources available and free on plantbasedhealthprofessional.com, and I would strongly recommend the episode of the Plant-Based Health Professional podcast called In a Nutshell, where there is our renal dietitian Angeline talking about all the things useful for kidney care. And these are my contact details, my email and LinkedIn. I'm not very active on social media, but please get in touch, and will be I will be very happy to share our stories and try to help and shape a better nursing future. Thank you.
Thank you so much, Giovanna, and Shireen. Thank you, everyone.
Thank you.
It's I mean, it's a really compelling case, and it's great to hear the work that's already happening. And the leadership that's being shown by different people. If people in the meeting would like to turn on their cameras, that'd be really nice, because we're just in the discussion part of the meeting. And I would be really interested to hear actually from people listening, whether this sort of lifestyle medicine is something that you already practice in kidney care, or what support you think might be needed for it to become more normal. And I know we have visitors, we have participants from beyond the UK as well, from different countries, so it'd be really interesting to hear perspectives. Shazia, yeah.
Thank you. Those are both excellent talks. I really enjoyed them. I guess from the point of how we get people participating more in lifestyle medicine, we have to factor in the barriers, some of which you discussed, and one of those I guess is apart from education is the financial and socioeconomic barriers of a plant-based diet, which often is much more expensive, and often the patients that we have don't come from the most affluent sections of our population. So how do you think that on a policy level we could overcome those?
Yeah, great question, and I'm sure Gio will pipe in after me as well. So just on a kind of research and literature level, plant-based diets, if centered around healthy, minimally processed plant foods, are about a third cheaper than our current British diet, as per sort of global analysis from Oxford University. Of course, if we swap out our typical Western ultra-processed food diet to one that's high in the newer plant-based products, and that is going to be more expensive. So like with all things, it depends, but we certainly recognise that people from lower socioeconomic groups are not going to have the time, the resources, the gas, everything that's required to cook from scratch. So totally get that. And I think this is a system problem, and the Food Foundation have been excellent at highlighting the fact that I think I saw an Instagram post today just saying that 1 in 10 families basically cannot afford a healthy diet, and it's probably much more than that, to be honest. And so it's not. So I think and we've also and I believe that you guys have endorsed it as well. So we've written a 10-point plan to government about what needs to be done to support people to make that healthier choice when it comes to diet. And it's not just about diet; it's access to healthy, clean air and green space, and all of that is much more difficult and disadvantaged communities. So we need to incentivize, tax, regulate, all those things that we know work when you think back to what worked finally, for tobacco regulation. We're in this silly position at the moment where the foods that are causing the ill health are the cheapest because they're subsidized in some way by government. And so, it does need a system-wide change, but I would be a bit more positive to say there are good practice examples. So one example that springs to mind is the Alexandra Rose charity. It always falls to third sector, but as part of their kind of social prescribing, they've been giving out rose vouchers to people via their GPs in Tower Hamlets, and the results of their studies have shown that this supporting people to buy and eat more fruits and vegetables has resulted in 78% of their recipients meeting their 5 a day. That's compared to just 20% in the regular population, and they've reduced appointments to GPs by 15%. So there are ways to get about this, and there's been a big analysis of social prescribing recently. So we have to find these ways to make sure what we do is inclusive, but ultimately to shape and change the health inequalities that are just getting worse in society, it does need political will, and that's where we should be using our voice. So we should be championing initiatives that will make healthy eating easier for the vulnerable groups. Gio, I don't know in your practice, because you also will be working in a mixed population.
Yeah. I would say in terms of cost, we do know what will be the projection if we don't change our behavior, if we don't change our lifestyle. So that will have even a huger cost on the NHS, and not to talk about the planet. But I do agree with you. When you try to bring some changes in a clinic, for example, or in your workplace, there will always be the discussion around, oh, we don't have a budget, we don't have the money. So what I will say, my advice is to start small. So for example, if you do want to demonstrate that some new way of practicing, like with lifestyle medicine, can help with patients' outcome, including in kidney case, for example, as we're talking today, just start, for example, with 10 patients and get the data for, I don't know, maybe 6 months, and that it shouldn't be a huge cost. Plus, all the things we talk about today in lifestyle medicine, like sleeping or sleeping well, exercising, these things are free, and people don't need really, it's not that expensive when you want to put theory into practice. It's not like prescribing medication that's very expensive and then people cannot afford.
Thank you. Mohammed, interested to hear your thoughts.
Yeah, thank you very much for the two speakers. Very tough presentation. I would like to ask about the intermittent fasting as a tool of lifestyle medicine. Can we include it?
Yes, I mean, I think, there's growing evidence, but for me, I think it's the icing on the cake. We have to get the basics right. And, we're so far away from a healthy diet at the moment. Less than 1% of the population adheres to our current Eat Well guide, that if we then layer in other things like intermittent fasting that really have these, small additional benefits when you've really optimized everything. So I think my view and the way I practice is really just addressing the basics and just elevating people's intakes of fruits and vegetables and beans, which we barely eat a portion a week at the moment when we should be eating like 2 or 3 a day, is where I start. And yeah, I think if you're in that lucky position where people really have done the most and adopted all 6 pillars and not achieving their reduction in glucose or body weight, then I would add that. But my assessment of the data, it's just another way of limiting overall calorie intake. I'm not yet convinced it has an independent effect, but time will tell.
So Shireen, when you have that conversation with patients about their diet and increasing beans and things like that, I mean, how do you feel you have to see them more frequently? Do you feel it's something you can integrate into normal practice within the time you have available?
Yeah, I mean, no, sadly not in haematology at King's College Hospital. I mean, the one thing I can tell you is that every person with a new diagnosis of cancer asks, what can I do? What should I eat? And so there's that moment to start talking about it, but it's not consistently done across different practitioners, different environments in the hospital. And really to embed this into, every day, then it needs to be, role modeled in the community side and made easy. So I do my best with the tools available and obviously use all the resources, but ultimately I think we need a better setup to embed, evaluate, refine lifestyle interventions. And there are good pockets of examples in secondary care around sort of group consultations for longer term survivorship things, but I think most of lifestyle medicine is happening in primary care, and I think we need a way of linking up. Unfortunately, my leadership doesn't seem to prioritise it despite banging the door, so let's hope other people have better luck in terms of longer term strategy.
Brilliant. Yes, indeed, echo that. And I'd be really interested actually to, maybe we could have in a future discussion to think about whether this is something that could be adopted at a kind of departmental type level and collectively as a multidisciplinary team.
Agreed.
Thank you so much, Shireen and Giovanna. It's been a real privilege to hear from you, and thank you also for saying that you would be happy to share your slides and the recording, so we'll make sure those are available to everyone on the network, and see everybody next month.